Hello all, I'm Pawan and today I'm going to talk about the social infrastructure development in India. So let us know what is social infrastructure. Social infrastructure can be broadly defined as the construction and maintenance of facilities that support social services. The types of social infrastructure include healthcare, such as hospitals, education sector, such as schools and universities, public facilities, such as the community housing and prisons, and transportation, which includes railways and roads. The economic development depends on the existence of an integrated infrastructure over social overheads, capitals, which generates externalities. This is why, since 1956, serious attempts have been made to build heavy industries in the public sector of India. In fact, one of the causes of expansion of the public sector in India has been the infrastructure building. Heavy industries such as iron and steel, coal, power, petrochemicals, heavy engineering, such as automobiles, etc., are essentially input supplying industries. This is why, since its very inception, the World Bank has played a positive role in infrastructure financing. Economic development depends not only on economic infrastructure like a well developed transport and communication network or the extension of irrigation facilities in dry areas, but also on social infrastructure. In a broad sense, economic development depends on expansion of not only society's production capacity, but also on social and economic opportunities. Therefore, not only economic infrastructure, but also human capabilities play a central role in economic development. Human capabilities depend on basic education, health services, ownership patterns, social stratifications, gender relations, and the opportunity of social cooperation. So, what is the government doing about the social infrastructure in India? Uh, the expenditure on social services such as education, health, and other social sector by the center and states combined as a proportion of GDP increased from 6.2 to 8.8% during the period of 2014 2020-21. This increase was witnessed across all sectors. For education, it increased from 2.8% in 2014 to 3.5% in 2021, and for health, from 1.2% to 1.5% during the same period. Relative importance of social services in government budget as measured in terms of share of expenditure on social services out of the total budgetary expenditure has also increased to 26.5% in 2021 from 23.4% in 2015. So what are the challenges faced by the Indian government in development of social infrastructure? India's social services are facing major challenges like a growing population, industrialization, and a globalizing economy that places a premium on information and technology, which is stretching the capacity of India's educational system to deliver relevant and effective services. Yet, enormous tasks remain. Getting 33 million children from poor families into primary schools, increasing the retention rate so that more children finish primary grades, and upgrading the average quality of the schooling received. In, in health, the country is undergoing a massive transition. There continue to be high rates of communicable diseases, malnutrition, and maternal and parental illnesses, representing a large unfinished agenda that predominantly affects the poor. There are also growing rates of non-communicable diseases, while rapid urbanization is creating new health problems. New diseases, notably AIDS, are placing great strains on society and the health of poor in particular. Even though the social sectors are challenging dramatically, the role played by the public sector has changed a little. What is the impact of COVID-19 on social infrastructure? The year 2020 began with once in a century pandemic, saw the frontline health workers working tirelessly to save human lives from COVID-19. While the pandemic caused its ripples on the economy and the social sector, governments at the center and states intervened in a timely manner to respond to the pandemic. India has one of the lowest case fatality rates of less than 1.5% in India and has been able to save lakhs of lives through its effective policy response. Public spending on social sector was increased in the year of 2020 to 2021 to mitigate the hardship caused by the pandemic, and the loss of livelihood due to the lockdown. During the lockdown, online schooling took off in a big way, and the government introduced several measures to make online education accessible to all the children. Similarly, the lockdown period also saw the growth of gig economy and increasing work from home in the organized sector. What are some suggestions to improve the social infrastructure in India? The need to broaden the coverage of elementary education among the poor and to improve its quality, including the targeted goal of universalizing it, means that more funding is needed, and states have to provide most of this funding. The central government will also need to expand its role in elementary education in view of low level of resources that many state governments devote to primary education and the large number of children not enrolled in schools. There is also a need to build in states, districts, the capacity to plan and manage education more effectively and the need for research to identify more cost effective strategies. Moreover, due to the poor financial or budgetary positions of the states, there is a need to reduce the implicit and explicit subsidies on the education sector. Thank you.